Welcome back, everyone. If you're training to become a medical biller and coder, you're eventually going to hit the ultimate fork in the road for your career. It's the moment where you have to choose the right certification to pursue. Earning your certificate from a reliable training institution is absolutely fantastic, but to actually succeed and get hired in this industry, you need a national certification from a recognized credentialing agency. In this explainer, we're going to look closely at the two absolute heavyweights in the medical coding world, the AAPC and AHIMA. We are going to demystify all those confusing acronyms and help you figure out exactly which path aligns with your dream career.
Okay, let's dive right into today's roadmap. First, we'll look at those two main organizations. Then, we'll break down the basic certifications for both the AAPC and AIHMA. After that, we'll help you choose your path. And finally, we'll weigh the pros and cons of holding multiple memberships at once.
Let's kick things off with Section 1, the two main organizations.
These two giants have completely distinct histories and career focuses. First up, the AAPC, formerly known as the American Academy of Professional Coders. They were established in 1988, and their primary goal was raising the bar for coders specifically working in physician offices and outpatient settings. So, if your goal is to work for an individual doctor or a local clinic, the AAPC is traditionally your go-to. Then we have AHIMA, the American Health Information Management Association. These folks have actually been around since 1928. Their initial mission was all about enhancing the overall quality of medical records, and today they are the main target for hospital coders. With the massive rise of electronic health records, their heavy focus is firmly on medical record integrity in those large inpatient hospital environments.
Now, you might be wondering, why even join either of them? Well, beyond just taking a test, becoming a member grants you some absolutely crucial career benefits. First and foremost, certification through these groups is the industry standard for employment. It's literally the very first thing employers look for because a lot of billing organizations are contractually required to only hire certified coders. Beyond that baseline, you get massive networking opportunities through regional and national conferences. If you're looking for a job or a solid reference, networking is vital. You also get some great financial perks, like discounts on your actual certification exams, study guides, and workshops. Plus, members of the AAPC get an immediate subscription to industry journals like The Coding Edge, which provides continuing education credits just for staying informed.
Moving right along to Section 2, AAPC Basic Certifications.
Let's de-jargonify this alphabet soup of credentials and map them to actual, physical work settings. For AAPC, the absolute gold standard, entry-level certification is the CPC, the Certified Professional Coder. Earning this proves you can read a medical chart and correctly abstract the diagnostic and procedure codes, making it absolutely perfect for a doctor's office. But they also offer some specialized fundamental credentials. The COC focuses on outpatient facility and hospital services. The CIC is devoted specifically to inpatient hospital coding. And if you want to work on the other side of the fence in the health insurance sector, there's the CPCP, which stands for payer.
But here is a critical detail for those of you just starting out. The APC has some strict qualifying criteria. If you pass that rigorous CPC exam, which, by the way, is 150 questions over 5 hours and 40 minutes, but you have zero previous coding experience, you don't actually get the full CPC right away. You get a CPC-A. That A stands for apprentice.
Naturally, you definitely don't want that A hanging around forever. So how do you remove it? You've got two practical options. Option 1. You can submit a request along with 2 signed letters. At least one of those needs to be on your employer's letterhead, attesting that you have utilized coding books for at least 2 years. Option 2, you can show proof of at least 80 hours of coding instruction, like a school transcript or a certificate of completion, combined with a letter from your employer confirming just 1 full year of professional, on-the-job CPT and ICD coding experience.
Let's pivot over to Section 3, AHIMA Basic Certifications.
AHIMA is the undisputed heavyweight for hospital-based coders. Here we have their 3 core credentials. The CCA, or Certified Coding Associate, is their general entry-level certificate. It proves you have a good all-around expertise for both hospital and clinic settings, though it doesn't declare you a complete expert in either just yet. Now, to prove true mastery, you want the CCS, the Correct Coding Specialist. This demands a much higher degree of knowledge in diagnostic and procedural coding, as well as a rock-solid grasp of pharmacology, human anatomy, pathology, and illness progression. Finally, the CCSP denotes that exact same mastery level, but specifically for physician-based settings like group practices.
Notice something missing there?
Unlike the APC, AHIMA does not offer any apprentice-level certificates. This is a massive distinction to keep in mind. AHIMA certificates are designed for individuals who are already quite proficient and ready to hit the ground running, with no apprentice buffer at all. For example, to even qualify to take the CCA exam, if you don't already have 6 months of on-the-job hospital experience, you must provide proof that you've received official, formal instruction.
Which brings us to Section 4, choosing your path.
Take a second and really ask yourself, which credential is right for you and where do you actually want to work? Picture your ultimate dream job. In the long run, what kind of medical billing and coding do you see yourself doing? Are you looking for the steady, predictable 9-to-5 routine of a small, private doctor's office? Or do you thrive in the complex, high-energy, bustling environment of a massive inpatient hospital?
To make this choice, you need to evaluate a few key factors. First off, look at your educational commitments. AAPC training leans really heavily into CPT codes for physician billing, while AHIMA training dives deep into ICD Volume 3 procedure codes, which are required for hospital inpatient services. Second, consider your desired work environment and day-to-day routine, just like we talked about. But third, and perhaps most importantly, you need to look at local employer expectations. Seriously, go look at the job boards in your specific area right now. What certifications are the local clinics and hospitals actually demanding in their job postings? If your dream hospital only values AHIMA's CCS, then my friend, that is the path you need to take.
Finally, Section 5, holding multiple memberships.
So the crucial point here is weighing the benefits against the very real costs. On the pro side, the theory goes that having both AAPC and AHIMA credentials essentially doubles your marketability and could potentially lead to a higher salary. It also vastly expands your networking possibilities since you can tap into both regional chapters. But you really have to consider the cons. The rising expenses are no joke. You're paying double the test fees, which usually run around $300 a pop, plus higher annual membership dues for both organizations. And here's the real kicker. Each certification requires a minimum number of continuing education units, or CEUs, to maintain your status every single year. Maintaining multiple credentials means a whole lot of ongoing time and money spent at workshops and seminars just to keep your certificates active. In fact, the source material actually advises against getting too obsessed with collecting certifications before you gain practical experience.
That really brings home our core takeaway for today, perfectly captured in this quote from the source text. Your long-term professional objectives are deeply, deeply tied to the kind of education you choose to pursue right now. If your education is heavily skewed toward outpatient and CPT codes, the AAPC path will naturally be a much smoother ride. But if you're diving deep into inpatient coding and medical record integrity, AHIMA is definitely calling your name.
Ultimately, obtaining a certification is an absolute must if you want to advance in this field. You simply can't skip this step. Whether you choose the physician-focused AAPC or the hospital-focused AHIMA, you need to prioritize your own career goals and commit to the path that best serves your future. So where do you see yourself making the biggest impact? Managing a busy doctor's clinic or anchoring a massive hospital network? The choice is entirely yours. Please like, share, and subscribe to Decode Healthcare with Harshal.